Hello everyone, I'm Dr. Hamza Al-Ashwah and we have a new case in our playlist, the examinations frame related to MRCS Part B examinations. Today we have ankle examinations, okay? And we try to illustrate it in two papers, okay? After introducing the room, we have our frame, wash your hands, introduce yourself and confirm patient details, and also explain the examinations and gain the consent and ask for the pin and the exposure and the chaperone and go for the mini scope look. This is orthopedic case, so you have to look and also feel. And in the another page, the also moving and also special test. And finally, we have to thank the patient and wash our hands again. To go by details, you have to firstly start by wash your hands, introduce yourself as we say good morning, good afternoon. My name is Dr. Hamza. I'm one of the surgical doctors today. Could you please confirm your name and age for me? Okay, and try to explain the examinations. Today I have been asked to examine your both ankles joint, which including look and feel and move and doing some special tests. Was that okay with you to gain the consent? And don't forget to ask about what? The pain. Okay. Do you have any pain at the moment? And ask for the exposure. Okay. We have to select the pencil. I think we have a problem. Okay. Okay. Uh, ask the exposure could you please expose both legs, okay, and also the examiner with you as a chaperone, okay. After that we go for look and feel and listen, okay. From standing position you have firstly to assess the gait, normal gait. Could you please take a few steps? And could you please take a few steps on your heels? Could you please take a few steps on the tip of toes? Okay. And also you have to inspect from the front. For what? For the when the patient is still standing. Okay. From the front. For what? For the symmetry of feet and ankle, for the swelling, erythema, any signs of inflammations, for scars, okay, and also inspect from the side, for the foot arches, for swelling, erythema, scars, okay, and also from behind for Achilles tendon, for symmetry, for scars, swelling, erythema. Okay, after that we go for feeling. Lie on the bed. Could you please lie on the examination couch? Okay, and go to assess temperature and compare it with the other leg, and also feel the dorsalis pedis pulse and posterior tibial pulse, and palpate the Achilles tendon, and also squeeze across the metatarsopharyngeal joints, and also palpate the tarsal bones, palpate the calcaneum, the medial malleolus, lateral malleolus, and also distal fibula, and also the proximal fibula for masonry fracture, okay, and go for the moving one. In the movements, okay, we have active and also passive. In the active ankle plantar flexion, dorsiflexions, and the toe, toe flexion, toe extension, and ankle inversion, ankle eversion. Okay, I'm clear so far. I hope this. Okay, in the passive one, ankle, dorsal and plantar flexion, subtalar inversion and eversion, metatarsal inversion and eversion, and also hallux flexion and extension, and toes flexion and extension. And after this, we'll go for a special tests. Simon's test, okay, squeezing on the calf muscles, and also anterior draw test, and also Taylor test. And this is way by Arabic language for an Arabic language. And don't forget after this frame to thank the patient. Thanks for let me examine you. Do you need any help to get dressed? Okay, and wash your hands and go for your examiner to present your case. By this way, you have to collect more marks. This is a systematic frame. Thanks for your listening.